let's see. So anyway, I'll just go ahead and start. So on the Cigna, once you get logged into it, you're going to go to your dashboard, and it'll have the different sections that are on the portal, and that's where you would be doing your quotes, enrolling, and all that. So there'll be two sections on there, and your first section is going to be the Medicare Advantage section, and then it will have a second section of the Cigna Supplemental, and then a third section for the prescription drugs on there. And then each section will have the section where you can click on it for quoting and enrolling. And then, sorry, he's trying to help me get this. I think Cody might have access to do it, so he's going to try to do it. Sorry, it's just kind of hard without being able to show it to everybody. But anyway, in each section, you'll have those where you can go through it, and then you can do your apps for the Medicare the Advantage plans if you want to, or I mostly just do the supplemental section on there because Advantage I write in a whole different portal. But the different kinds of policies that you can write out of there would be there's the dental, vision, and health, the different cancer ones, heart, lump sum, accident, hospital indemnity, whole life, and then Medicare supplements as well. Let's see. Need to. And then, sorry, I'm trying to get this to load. So the dental and vision I sell, that's quite a bit what I sell a lot of. Hey, John, is there a way you can mute your thing, please? Thank you.
I'm sorry.
No, it's no worries at all. So the dental and vision, they have really, really good options. So you can have it set up with different co-pays or like the deductibles. You can do $150, $0, or ascending one. And then you can also have the option to keep it lower if you, which I don't normally quote, but would be for the I usually do the first year full benefits when I write their dental and vision. And it's a very, very good coverage on that. The accident plans that they have, those are amazing. I wish I was going to show you the brochures on that. But their accident is really, really good. And it's a good thing to also add on to just to life policies as well, to get those recording on the site.
I'm just trying to help with the.
I know.
You have to allow me to do this.
Sorry, he's trying to get this to load up on here. Okay,
hey, Christina, I have a question. How's the claims paying on those? Have you done any claims yet?
Actually, I'm doing my very first. Well, for the dental and vision, I've had people do claims on those, and they haven't had any issues. I'm actually just doing my very first claim on the hospital indemnity with the skilled nursing, and unfortunately, she passed away before we were able to even get anything submitted. So I don't know how that's going to go right now, but fortunately, I haven't had to do any of those. But I guess we'll see after today how that goes. From what I do understand from Dave was telling me that a lot of times you just get the full like detailed billing from not like what they send to the insurance or to the individual, but you just get the full billing detailing from the hospital or the wherever they're at, and then you can help submit it with that. Oh, good, he's getting it loaded up for me. So.
Okay, thank you.
You're welcome. I'll let you know. I just haven't had to, fortunately. I mean,
Okay. I was just curious.
let's see. You can go to the next one, Cody. And then the cancer ones, which we're implementing with Velocity on with cross-selling when we're doing live sales. They have really good cancer plans on there. And then some you can have them where they will pay to the hospital or doctor or whichever. And then there are lump sum ones as well. And then you can also add these as riders on other, like the hospital indemnities plans. You can add those as riders on there as well. And then there's the heart lump sum, which is really good as well, which that's another one I'm going to be putting in on. So I have not done a claim on that, but I am doing that today. And then of course, and then there is the hospital indemnity, which I do sell quite a bit of those, especially when people are they're under 65, but they're still I mean, they're in their like late 60s or, where they're getting ready to cross over into the Medicare, because the out-of-pocket costs that people are incurring on these marketplace plans is what a lot of people have, even their work plans, like their deductibles are so high, and then their out-of-pocket expenses are so high. I mean, it bankrupts people. We just did a training on that the other day, because let's see, it was, if you have a heart attack, the average medical billing that you'll receive for that, it's going to be $45,000. If you end up needing to have surgery along with that, with your heart attack, and you're in the hospital, it's $110,000. So these people, if you're having a bronze plan, that's going to have a 60-40 or 70-30, where the insurance is paying that 60% or the 70%, and then your co-insurance portion of it, your out of pocket, it's going to be that 30 or 40%. If you're getting a $40,000 or $45,000 bill, I mean, it's going to bankrupt people. So these plans are really, really good to have to help cover those expenses for those people if they're getting those bills. Me personally, when I'm really, I have a heavy heart about helping people with saving money with their Medicare, like their medical costs and all that. So a lot of times you can get people put into like the 70%, 70-30 bronze plans at a much, much cheaper rate, between $0 to $100 and something dollars. Instead of like a gold plan, which would be costing these people, $600, $700. But adding on these supplements on top of those bronze plans, which are only adding on, $50 to $7,500 for those plans. And then they end up covering more coverage than those gold plans through Marketplace would have. And we personally use supplements along with our health insurance, and it saved us tremendously. The accident one, that is, pretty much anytime I do a health insurance, I do usually try to explain all like the accidents and all that, how the accident plans work, especially if you have children. I mean, a broken arm or a leg, that's going to cost you like $7,000 to $15,000 if you take your child to the ER and have that set. Or and more, of course, if they need surgery with pins and all that. So those are really important to do. And then, of course, under that supplement section, even though it's Medicare, you'll have the supplements that are in there. You can go to the next slide. So on the supplements that are, or in the Medicare that's in the Cigna portal, of course, you have your supplements, which you can get the parts A, G, H, D, G, N, F. I mean, each state, of course, zip code's going to be different, which plans that they're offering in that area. And of course, by age. You have the Advantage plans, and then the drug coverages that you can do, like the Part Ds. You can go to the next one. And then who are these plans for? Like I said earlier, that they can be utilized for all ages. It's not just for older than 65 or a Medicare. I utilize these all the time. And like these can be used in the conjunction with Medicare, ACA plans, and work health plans. Like I said, they're a great add-on for life policies, like the cancer and then the accident ones. Those ones that we really explain to people with life sales. Go to the next one. These plans, these supplement plans, you can have them to where they can be set to pay directly to the doctors or the hospitals, whichever one. You can have it paid directly to you or to the client. The lump sum benefits, those will almost always pay to, they always do actually, to the client. Those are really good, the lump sum ones. So like if you have cancer, a lot of people are traveling, if you're not working because you're sick and you're doing like treatments, chemo, radiation, and stuff like that. These benefits that these lump sum ones, and they can utilize for their bills, travel, anything like that, any other out-of-pocket costs. And then, like I said earlier, about helping them with keeping them out of debt, that's a very, very important thing. That's important that I put across to people, just like we were talking about that with the SRS, like with the Simple Retirement Solutions. Comments and I have been talking about our team about all that, because when people are having their retirement set up, they have only a certain amount of money that they set aside for retirement. But if you're, I think Thomas had said, I think 495,000 is about average of what most people have saved up for retirement. And one huge medical bill or getting medical treatments for cancer or anything like that, that's just going to drain their retirement. So when they have these in place, it's helping save their retirements as well. You can go to, I think, is that the last one? Yeah. Okay. You can stop sharing that. Does anybody have any questions about any of this?
Good here, pretty clear.
Okay. Let me see if I can get it.
I had a question. Like, what are you working like a warm market? I know you mentioned last time that, if it was a life lead, you would kind of, transition or, hang up, transition. Like, what kind of leads are you buying? Are you buying health leads? Are you working your warm market?
I do a warm market. I had leads. I had a Facebook funnel going for health and all that. I get a lot of referrals from people. And that's a big thing, I think, with health. Once you start gaining people's trust, with all that, then you get a lot of referrals. Unfortunately, like this lady I was talking to you earlier about that, I'm going to be doing a claim on. So we've helped her out with her annuities, her Medicare, her life, like all of that. She's a really, really nice lady. I actually grew very, very fond of her. So, because we've been working with her for a little bit, so it's kind of sad actually. But when people you start working with people like that, you get a lot of referrals. They send a lot of people to you, especially with Medicare. Especially older people, when they trust people, that they send over referrals. So hopefully that helped. But yeah, the funnels work really, really well, the Facebook ones. So there was a point, because I think with the Medicare funnel, or not Medicare funnel, but the whole health funnel, because it was for everybody, because I do small business as well. But I think those work so good, because they are usually about an 80% close rate on those, as opposed to like life, which are quite a bit lower. So,
Hey,
but
hey, Christina, you can list spell those the Cigna policies, right?
do what?
You can list spell them, which means that you can have them come out like have them paid by the company, like almost like payroll.
Yeah, I haven't had to do that yet I haven't done that with the company yet with Cigna. Primarily when I'm doing with company benefits, I'm doing Manhattan,
Okay.
because they're really easy to work with on that. And I think most of my small business stuff is, I think probably 95% of it's through Manhattan because they're quite a bit easier to work with payroll.
Okay. Okay.
So, and I don't know if you have, there are different couple contracts with Manhattan because one that doesn't have like the main one most people get, it doesn't have all the different types of products that you can sell. There's a second one that you have to get that has more of the business stuff in it.
You
So
mean for Manhattan?
yeah.
Okay. Okay.
Yeah.
Yeah. 'Cause can you list who your contact is? Because I tried to call about just trying to get some more guidance on that. Because I used to do used to do a ton of Aflac, but I couldn't get anybody to really give me any information on who to contact with doing some more of the group stuff. With businesses.
Yeah, I really haven't I haven't really been able to really get in touch with anybody. It's mostly my Manhattan stuff that I've done. We went through, we printed off everything, those products forward and back from the brochure, and then talking to like with the underwriters when they email and all that, with the communication, because some of the other stuff is a little bit like like the Central Choice, for example, which is good with the small businesses. It says like there's add-ons that you can add on that to increase it, but apparently they just include all of that anymore. They just haven't updated their applications. But I pretty much just learned it all myself. Did a lot of studying on it, but I have emailed a couple of people, but it is hard to get a response from them, to be honest with you, which sucks. But I really haven't had too much issues with them. But I know it really, really well. And most people, like on our team, if they have questions about Manhattan, they usually come to me and I'm able to answer them for them. So I'm happy to help out if you have any questions with it. And then like the contracting for that other one that they have, the second contract with them, I just had to reach out to Danielle to get it because
Okay.
not everybody had that one. So
I got you.
yeah,
So
Dave didn't have it. I request.
Daniel under Dave.
Do what?
Danielle under Dave.
No, Danielle was doing his contracting at the time. She's with Elver now, but I think she's gonna be helping him out a little bit. But Dave didn't even know about the other contracts. Until I
Okay.
requested it.
So you said she's under Alvira or she's still under Dave?
No, she doesn't sell. She just does his contracting for Elver.
Yeah, no. I was just saying, is she his admin for Alvira?
Yeah,
Okay.
yeah. Danielle's Elver's admin now.
Okay.
Yeah,
All right.
she's amazing. She's great, and she still helps me out and stuff.
Okay, cool.
And
Thank you.
you're welcome. Does anybody else have any questions about Cigna or any other products? The other good thing about the Cigna accidental plans is that they include the accidental death. I believe that it was 50,000, right, Cody? Even with the Cigna.
Yeah.
So when you have the families, which is great, it covers each of the individual people in the family with that coverage, that $50,000 accidental death benefits with those. And then a lot of them, they end up covering like accidental or like emergency dental, like you fall and break your tooth or anything like that, or break your tooth, and your dental doesn't cover anything like that, or you don't have dental, it'll help cover that. Covers chiropractic care, There's a whole bunch of just different stuff that they cover that are just really beneficial. And then let's say even if your insurance company covers those things, you can still turn those in on those plans and you'll still get reimbursed for those. So even let's say you're getting a surgery, but your deductibles met, your out of pockets met, and you're not even having to come out of pocket for those surgeries or any of those expenses. You still turn those in on these plans and still get a reimbursement for them. So those are really, really good. So let's see. Skylar, do you write a lot of Cigna supplements?
Yeah, I do write a lot of Cigna Medicare supplements. You know, in the areas that I wrote, they've got really, really competitive pricing. And so it's been nice to have that in there. The nice thing that we have is that CSG actuarial app in the Medicare Center, and Cigna is generally in the top bunch in the states where it's strong. So not every single state, but in the states where it is, it's a very, very strong product. And there's also some other ancillary benefits that can come with it, depending on the state. Like I've seen them have some gym membership with that particular plan as well, with their supplements. So it's been a nice addition to the carriers that we have. I haven't written a lot of the cancer policies in the states where I'm in. I don't have a lot of, or the states that I've been writing recently, I don't have a lot of their other ancillary products in those states. Just maybe like a cancer, but I don't have any of the dental or vision in the states that I've been selling for that. So I wish I did, because I know their products are strong. So yeah.
Yeah, it seems to me also that when I haven't been able to get people covered with Aetna, like on their supplements or even those products, Cigna normally takes them. I haven't had an issue with them actually declining people for coverage so far.
Yeah, they've got a pretty easy underwriting when it comes to that. So the one thing I want to make sure that everybody knows about the Medicare supplements is, even if somebody's got a Medicare supplement in place, that doesn't mean you can't write another one for them. You can't get them in a better position and change their supplement. They're going to have to health qualify. So make sure that when you go in, you're going to ask them some of the health questions. What have you been dealing with lately? What kind of medications are you on? Things of that nature. And then if you're still unsure, open up the medical questions. Find a form with the policies that you're looking to write and go through the medical questions with them and see if they can answer no to all of them. If they can answer no to all of them, go ahead and try to get them a better rate with where they're at. Because oftentimes you're going to come across people that will have a plan that they've been on for 10 or 15 years. And within those plans, it's just gone up and up and up and up. So if you can come in now and put them in something new that has a better group rating or group class in that Medicare supplement to get them a cheaper price, that's what you'll want to do. So yeah, keep looking for those opportunities, especially with the Medicare supplement. And once you open up that, if that's what you're going in for, Medicare, all these other ancillary products will open up. The dental vision, the cancer, the hospital indemnity, all of that stuff opens up once you can build that trust with the main product that they need. So yeah.
Yeah, I wish that they had more, but we don't. Texas seems like they have quite a bit of these products that we don't. And Virginia is kind of smaller, like on what you guys have or can get.
I just looked again and I was like, oh, we only have the supplement and cancer. That's it. So
yeah, even I think one or two of the states I've noticed too, their vision covered LASIK, just like with the Manhattan, it covers LASIK. I'm like, most dental and vision don't cover anything like that, and the deductibles are just so much lower. I normally sell, like if I do marketplace plans, I normally don't sell dental and vision from the marketplace plans because they're just not as good. They don't have as much coverage. And usually like a year or 2 years before like they even cover anything. Cigna, like Cigna does cover if you do choose that route, which is only like normally $1 or $2 more on the dental and vision for the first year coverage. It's worth it. So I normally don't even offer the 1 year wait, because for $1 or $2 I'm not going to, but I do think it's a good, like if you go in there and look in the portals, and for everyone to pull the brochures, like the agent brochures, and read over them and look over them, and all that, just to get to know your products. That's pretty much what I did with most of my other stuff. When I was doing life only before I started doing this full time, downtime, I was just reading, educating myself. I think that's very, very important with health.
Yeah, that's what it takes in this industry. Know your product. Don't feel like you have to know every single product. Pick a few. Find out what in your state is available. Find out what some of the top products are as far as premiums go, and then study those products. These carriers will actually have either videos on their sites, or they send out emails all the time saying, hey, go to this training, do this training, do that. Tune into that stuff. And this is how you educate yourself in this business, to be able to talk confidently with your client. But even before that, even if you just have a little bit of knowledge, talking about it with your client, guess what? You have more knowledge with that little itty bitty knowledge that you have than they do. So you can still be the expert, even though you don't know everything. You bring it up to them. And one of the things that I did when I first got into this industry was I always use the phrase, you know what? That's a great question. Nobody's asked me that before. Let me research it for you. And then maybe you can hop onto the site and go to an underwriting guideline and look it up right in front of them. That builds so much confidence with your client, because they know that you're not just telling them something. They know that you're actually willing to do the research and really willing to work for them. The trust that's built in doing that right in front of your client, it is tremendous, and you will get a sale out of it, 9 times out of 10, if you show your client that you're willing to do the research and you admit, hey, I don't know that. Let me look it up. And so it's a valuable tool that we have, and just the speech and the willingness we're willing to go through for our clients. So.
Yeah, I will also mention that when you are just selling these products, I do get a lot of calls and emails and text messages, asking questions about utilizing plans, like especially the accident and dental and stuff like that. You have to reply. You have to get back to these people. You're going to lose your clientele. You're not going to get referrals at all. But
Yeah.
You want to keep that trust, and you will. Another thing is I think people need to understand too is you are on the phone a lot with carriers asking questions and stuff for them as well. So I think people need to be prepared for that also, because there is a lot more just selling the policy, like a life one. It's more work. So yeah, up to do that. So
Yeah, very good, very good. Well, does anybody else have any other questions? I'm satisfied with what you thought this morning, Christina.
sorry, it was such a hassle with the getting everything going and all that. So
Hey, we're still in the beginning of this thing. We'll get it all figured out. And, just with the ones that are tuned in now, tell all your friends that are in the industry about hopping onto this thing and joining what we do, because it can be very, very beneficial. These are some of the best residuals and renewals in the industry. This is how you build a solid insurance book and stay in this industry, is using these types of products that we're talking on these calls. So yeah, perfect. Anything else you want to add, Christina?
no, no. I just think I personally think it's good to be well-rounded with everything, like their health, their life insurance, and their retirement. I think it's important to because everything is intertwined, everything works together. Whether you think it does or not, it does. Like I was saying, with the retirement, like their money for retirement and their health, that's an important thing. So, I think it's good to make sure that you utilize all those aspects of it, when you're working with clients. So that's pretty much that's a big thing for me. So other than that, I don't have any more. So
Excellent, excellent. Well, we'll give you guys back some of your time today if there's no questions, and we'll leave it at that.
awesome. Thank you guys.
Thanks everybody for being on. We'll talk to you soon.
Bye.